I am the University of Idaho Extension Sheep Specialist. I also work with range livestock, so I work on, um, various cattle, sheep, goats, grazing type topics as well. But I do work with the sheep producers here in Idaho, and we do have a monthly webinar that we provide for sheep and goat producers. So I'll put a link up at the end for you guys to jump onto that if you would like to join us. My background is in cattle originally. I grew up on a cattle ranch in Colorado, and when I went to college, I started working with sheep, and I have a small flock of my own that I raise, as well as being the sheep specialist for the university. So um, I've learned a lot over the years, and hopefully I can share some things with you that will help you as you prepare for lambing. So we're going to touch on a lot of things today in short segments. And so if I miss anything, make sure to save your questions or even jump in if you'd like as we go along so that we can make sure to cover everything fully. So I like to start out with just a good understanding of what a healthy sheep looks like. And I apologize if there's any goat producers in the room as well. We're going to touch on those a little bit, but I'm more of a sheep person, so I will hit sheep mostly. But goats, especially this time of year, are going to be very similar. So we talk about a healthy sheep. We want to have some tools in our toolbox to be able to identify when an animal is healthy versus sick. And one of the things that I think is the most interesting about sheep, everybody says sheep are born to find somewhere to die, but I really truly believe that sheep are just very tough. And by the time they show us that they're sick, it's actually really bad. And they're in a place where they're not doing very well. So when we actually see those physical signs of an animal that's being sick, it's often pretty close to too late. So I like to have a thermometer on hand. So if I see anybody who looks a little down or isn't coming to feed, you can take a temperature and you know for sure if they've got a fever, something is going on. So an adult sheep, anywhere from 102 to 103, it can fluctuate by a degree or two, but as long as they're not shooting up over 104, 105, they're probably doing okay. Lambs are going to run a little bit warmer, but if they hit 105, 106, they've got a fever and it's pretty bad, right? They're going to breathe about 10 to 20 breaths per minute. Their heart rate, if you have a stethoscope, not everybody has one of these, but you can actually get one on Amazon or somewhere for pretty inexpensive. These are nice to have because if they have an accelerated or a decreased heart rate, you can also tell that something's going on. Fecal production is probably the least important to watch of all these things, but certainly if they're having loose stools or they're not having any defecation at all, that's not a great indicator. So certainly understanding a normal behaving animal, if you will, and then being able to see when they're acting a little bit off. Like I said, a lot of times sheep can be sick and not show us any external signs, but I do know that they will pretty much go off feed for 3 or 4 days before they ever show signs of being ill. So that's a great indicator. So as we get where we're coming up on lambing, I'm going to talk about some things that we can do in the last 30 to 45 days before you start lambing. Probably by the time you hit that 30 to 45 day mark until lambing, you've already done some of these things. But just one of the ways that we know if an animal is pregnant is to do some kind of a pregnancy check. These can be an ultrasound that is transabdominal or transrectal. As we get closer to lambing, we're going to see some of those udders get tighter and start to create milk. And that's in the last couple of weeks prior to their parturition. And there's also a blood test that you can send in, and that's usually something you can do in less than 30 days from when they're bred, which is the quickest way to have a pregnancy test done, but a little bit more expensive in a lot of cases. So I'm a nutritionist at heart, and I believe wholeheartedly that nutrition is the key to healthy animals. So I apologize that it's a little weighted this way, but I think having a good nutrition program and having animals that are in good condition is going to be your number one saving grace any time of the year, but especially as we come into lambing. So one of the things I like to discuss is how do we understand their body condition, especially if you've got woolly sheep. These are ways that you can tell. So this is looking at a sheep from the back. You can see this is going to be her spine, and this will be her hip bones. And if you are seeing or feeling, a lot of times you're going to have to put your hands into the wool to feel some of these things. But if these are very prominent, these bones, then this sheep is not in very good condition. If you can't feel the bones at all, she's overly obese. And these are both places that you don't really want to be, especially coming up on lambing, because it can cause some metabolic issues when you're getting closer to parturition. I certainly like to strive for around a 3 to 3.5 body condition score when I'm especially coming towards lambing, because when they lactate, they're going to use a lot of energy and they're going to lose some weight, lose some of their body stores, especially if they're not on a good feeding program once those lambs are born. So this is, you want to be able to kind of tell that these bones are there, but you don't want to feel them very pronounced. You want to have some fat covering between the spine and the hip bone, and that's going to be an indicator that they're in good condition. So this is kind of a chart where we're looking at a sheep that is 160 pounds, and it's sort of the whole scheme of her life through a full year. So we've got the breeding here. This is gestation all the way up to lambing. So this is a curve of where your body condition should be. So you can see at breeding, you want them to be right about that 3 body condition score. As they are going through gestation and up to parturition, they're going to gain weight. So you can see this is the weight score because they're carrying fetuses, right? But you also want to be giving them a really good nutritional diet to make sure that they're getting everything they need, both to keep themselves in good condition and to cook those babies, if you will. It requires a lot of energy and protein to make a baby. So we want to get that body condition to stay around that 3 if we can. And certainly they're gaining weight due to those fetuses inside. After lambing, you're going to see both the loss of the fetuses as a loss of weight, but also as she starts to lactate, she's going to be using a lot of her own body stores to make sure those lambs are getting what they need. You're going to see a body condition and a weight drop off after that period. So you can see if you had a sheep at this stage, right at parturition, when those lambs are born, if she is not in very good condition and she loses 20 or 30 pounds, she's going to be in really bad shape. So these are points that are really critical for making sure we have a good diet. One of the things that we have to consider is how much an animal will eat. And most of the time, sheep and goats are going to eat about 2 to 3% of their body weight every day. If they're young and they're still growing, they're going to eat a little bit more, 3 to 3.5%. So this chart is just showing you if a 160-pound mature ewe at her maintenance, there's no babies on board, she's not lactating, she's probably going to eat around 2.8 pounds per day. This is just shy of 2%. She doesn't need as much energy to be able to do just regular living. When we're breeding, we're going to start to increase our intake. And as she goes towards that gestation and parturition phase, she's going to continue to increase how much she's eating. And then it drops off a little bit once she's kind of done with that heavy lactation. And this is just showing a very similar curve with a ewe lamb that's still growing, and she's going to get to this full 160 pounds. So this is just kind of that calculation, how much these animals can eat or will eat, and that can designate a little bit more for us. But the biggest problem when we're feeding ewes at going towards lambing is that they are not only having room to feed themselves, but they're also having babies pressing up on everything, right? So Phil all the times of the year, there's only so much that they're going to eat. But it's certainly going to become more of a problem as they get closer to lambing because there's just not as much room in there. So this is why during those periods, we need to give them feeds that are higher in nutrition, higher density in protein and energy, where they don't have to eat as much to get what they need, if that makes sense. So we're going to look at this and say this is a 160-pound mature ewe. This is late gestation. She's getting ready to lamb any day now. If she has 1 lamb versus 2 or 3 or even more, it's going to change how much she's going to need to consume to be able to get what she needs. But take note that if she has 3 or more babies inside, she can't eat as much as she probably should. So these are all numbers that we're going to have to talk about on a different day to get really in the depth of it, but I will talk a little bit about what they mean. Dry matter is going to be the dry content of the feed. So if you're feeding hay, there's going to be a little bit of moisture in that hay, and the water that's in those feeds does not provide any nutrients. So when we're balancing a feed ration, which of course I'm happy to help you with because it's very complicated and we could go on for days to get there. But I do have some other webinars that I've given that I can share with you if you would like to get into that a little more deeply. So we base it off of the dry content of the feed. CP is going to be your crude protein. That's the amount of protein that is in the feed. TDN is the total digestible nutrients, and that value is what we use to identify how much energy is being provided to the animal. So this, if we're just feeding a regular grass hay, a brome hay, these are the values that an average brome hay has in them. So let's say we're going to feed 5 pounds a day to this ewe. If we feed 5 pounds a day to get to our full amount of feed that does not include moisture, we actually have to feed 5.5 pounds a day. If we feed 5.5 pounds a day, that animal will be getting 0.49 pounds of protein out of that diet every day. And the animal will also be getting 2.75 pounds of energy from that feed every day. So if you see here, we're going to be covering the requirement of how much this animal will eat for all of these, except for when we have 3 or more lambs and it's after we've had the baby and we're lactating. So that animal is not going to be able to get enough feed if we're only feeding 5 pounds per day. This particular hay will meet the requirements of a sheep that is having 1 lamb or having 2 lambs when she's about to have those babies. But it does not meet the requirements for anything that has 3 or more lambs or during any of these lactation phases. So let's say that we're only feeding 4.4 pounds per head per day, which translates to 4.8 on the ground. And you're going to get 0.43 pounds of protein and 2.42 pounds of energy. And if you only feed 4.4 pounds per head per day, because we're targeting maybe these ewes with twins or singles, we're actually not meeting any of the requirements that they need to be able to get that baby grown up and not lose body condition. So it's really important to understand that some of our feeds are really bulky and they don't provide all the energy and the protein that they need. So this is when we start to supplement with things like alfalfa or corn or whatever we have available to us to help boost that protein and energy in those animals. So just a few notes on placing feed. If you feed out on the ground, you want to make sure to provide feed in clean spots as much as possible. If it's really muddy, move those feed areas around so that you don't spread as much disease and they are able to get the clean feed into their system. If you feed in feed bunks, this decreases that chance of feces and urine on the feed, that type of thing. They're going to maybe waste a little less unless you're feeding free choice. Once you're feeding free choice, there's a lot of waste that goes on when you're feeding. But whatever you end up doing, you want to make sure that you give them enough space so that they are able to all get what they need. If you have one feed bunk and too many animals using it, you're going to have a lot of animals that maybe aren't getting the feed that they need. And that's going to cause you some problems down the road. It's that whole hierarchy, boss you and the ewes that are young and not as bossy don't get as much as they need. And a reminder that when it's really cold at night or during the day, bad weather, that type of thing, it's really a good idea to bump how much you're feeding them because they're going to consume more to stay warm. And certainly if they have 2 or more lambs or kids, they're going to need a little bit extra boost for protein and energy. So if there's any way to supplement them, that's great. It's also really important to provide a good water source. They're going to need anywhere up to 5 gallons a day, especially if they're lactating. Milk production requires so much water. And so making sure you have a clean source of water and that it's a little bit warmer than, like if you have a way to warm it up when it's winter, that helps them intake more water than if you have it really cold during those days. So sheep actually can utilize snow for water. It's something they sometimes prefer to do actually, but I still think it's a good idea to monitor whether they're getting enough. I mean, some of that snow can be really dry and not providing enough moisture, and that's not going to be good for the lambs when she's lactating. So also prior to lambing, we want to talk a little bit about vaccinating. So I'll talk about why prior to lambing is the recommendation that I'm making. But certainly a good vaccination program is going to give you some benefits, and the benefits are going to outweigh the cost and the time and all of those things to put the vaccine into the animal. So for example, you don't need to vaccinate for sore mouth or things like that if you've never had it in your flock. The rule of thumb for at least me personally is to vaccinate for the clostridial diseases, and especially with tetanus if you're going to be doing any castrating or tail banding or anything like that. Tetanus can be a problem when you have those open sores in the lambs. But clostridial diseases are going to be the most common and the easiest to prevent through vaccinating. And then there's also going to be other farm-specific vaccination programs that you might want to use. If you are having issues with abortions, late term or otherwise, sometimes there's foot mouth or sore mouth or rabies. I said foot mouth, I meant foot rot. These are all things that you could vaccinate for, but I wouldn't recommend it unless you're having problems with it, if that makes sense. So the reason that we want to vaccinate is because we're going to prevent spread of disease throughout our whole flock by stimulating that natural immune response. So sheep and goats do not, and cattle too, in fact, do not get passive transfer in the uterus from their mothers. So they have to have colostrum, which is why colostrum is so important to be able to develop that immune system. And so some of the studies that we have is if there's lambs and kids that don't have colostrum in that first 12 to 24 hours, your mortality rate for that animal is likely going to be greater than 70% chance. So it's really critical because of that passive transfer to the offspring from their mother. So this is some research that came out of the U.S. Sheep Experiment Station in DuBois, Idaho. They were working with antibody responses in the pregnant ewe. So this purple line is going to be the ewe and the response that she gets to a vaccination. So if we hit her with a CD&T or an 8-way clostridial vaccination, we're doing it at about 45 days prior to parturition. That primary, and this is a ewe that's never had this vaccination before, so I should note if they have had it before, they don't need a primary and a secondary. They just need an annual booster. But that being said, we're going to hit this ewe with a primary vaccination 45 days before lambing. You're going to see that her immune response is going to jump up over the next 10 days or so. And then she's going to start to decline her immune response until we hit her with that secondary, which is going to happen between about 2.5 weeks before lambing. And then her response is going to jump. So this is the response in her body, and this is what she's transferring now. If you see this decline that's occurring, this is her passing these antibodies into her milk as she's coming up on lambing in that last 2 weeks. When that lamb is born, you can see that as soon as they get that colostrum, this is the immune response that they are exhibiting in their system. Over the course of 3 weeks, you can see that their immune response is sort of declining. And at this point, this is when we can give them that first vaccination for themselves. So the dam has them covered in those first 2 to 3 weeks, and then we can start to see that we're going to need to help them out at that point. So this is going to be a graph of the lamb's response. This is a lamb who did not have a mother that had those passive antibodies in her colostrum. So these lambs are coming from dams that have never been vaccinated. So these lambs are born at 0 days, and say we hit them with a vaccination right on day 0. You're going to see almost no response in that first week until they're about a week old, and then you see a bump from that first vaccine. You give that secondary shot at about 2 weeks old, and you're seeing the increase from there. Now, if you remember back, we're suggesting that we wait for 3 weeks to give the lamb their first shot, and this is why. So if we see that the animal is having their first injection, this is at about 4 weeks, but anywhere from that 2-week to 4-week period, it's going to have the same response. We give them that primary vaccination. We see an immediate response to that compared to no response in the first week or from the earlier lamb. And then these lambs have a jump for over a couple of weeks. They get their secondary injection, and you can see here that they have a more elevated response to that injection because they had this initial jump right at the beginning. So this is why we're saying if you vaccinate your ewes 30 to 45 days ahead of lambing, they're going to provide in their colostrum those antibodies for the lambs over the first 2 to 3 weeks, at which point then you can provide them with that extra protection going forward. So this is a chart of those same lambs that are then being weaned at about 155 days. I guess 160 days. So we're going to provide them their booster shot at this point because they're going to be weaned and dry lotted. We want to give them a booster for their clostridial vaccination. So if you take these lambs, this green bar are the ones that we vaccinated on day 0, and this purple bar is where we vaccinated lambs at 4 weeks old. So at this point in time, these lambs that were vaccinated later in their life at 4 weeks compared to day 0, they are already showing they're still having that immune response in their system. Oops, gotta go back. Sorry about that. This green bar is showing that there's really almost no detectable antibodies in the system of the lambs that we gave the vaccine on day 0. So this is where we start to see that boost is saying, okay, we got better boost when we give them the vaccine when they're first born at 4 weeks. And later in life, they're still showing an immune response. We probably wouldn't have even had to give them this booster to protect them from what they were going to be exposed to after weaning. So a lot of people like to vaccinate when they're born. They like to give the lambs the vaccine instead of the ewes. And this is just a recommendation based on research at the sheep station that's suggesting vaccinate the ewe, let her provide that passive immunity to the lamb, and then after they're 2 to 4 weeks old, give them the vaccine again at that point and start them on that cycle. And that'll give you the best bang for your buck on vaccinations. I want to touch a little bit on internal parasites, although another topic we could get really deep on, but it's something that I want to mention just going into lambing. I don't necessarily recommend doing a full deworming program with your ewes before lambing unless you're seeing some kind of an issue that's occurring with them. So you could certainly do some checking their fecal testing. You can take fecal samples and put them under a microscope and see what exactly the parasite load is and what type of parasites they have, which you can be a little more targeted in the type of deworming that you do. Certainly don't have to do it on every animal, but if you have a handful of animals that you take samples from, if one has a load of parasites but the rest don't, you're indicating that maybe just a few of your animals are having some issues that way. If they are having poor condition, you can do some FAMACHA scoring, which is you can train to check under the eyelid for iron deficiency. If they have that pale membrane, they might have some parasites happening. But certainly individualize those parasite treatments unless everybody's sort of seeming like they are having some issues, or if you've done some testing. We do have parasite resistance that occurs in our internal parasite control programs. And so the more that we treat, the more resistance that occurs. And so we just want to try to weed out those animals. In particular, if you have animals that are having a worm problem regularly and the rest of your flock is not, this might be an opportunity to cull animals that are not as capable of decreasing their own parasite load. Here's just a chart that talks about the types of dewormers that you can use in sheep and goats. This is one that I can share with anybody that's looking to have it. The main thing here is that there is some potential for valbazin to not be safe for the first trimester of gestation. Otherwise, you should be able to utilize any of these dewormers during gestation. And just note that if you do have a dairy flock or herd, these are some withdrawal periods for each of those. Another one to mention is if they're having external parasites, you want to work to control those as well, just for the health of your flock. Another pre-parturition thing to talk about would be shearing. There's a lot of people that will shear 30 to 45 days prior to lambing. This provides just a really clean environment for those lambs to be born into. They're going to be able to find the udder more easily. That's going to encourage the ewes to seek shelter more readily if it is kind of cold outside, which helps protect the lambs as well. And your wool is going to be cleaner at that point. One of the things that we have to consider, though, is if we're in an area where it's pretty cold, don't want to shear full fleece in a cold month. And you're going to have to provide some shelter for those animals, even if it's not a cold area, just for those colder nights. Another alternative to a full shear would be what we call crutching, which is just removing the wool from around the hind end and the udder. This allows that access for nursing lambs without having to have all that cold stress happen to the ewes. One of the things that would be the con to that would be A, you have to do it twice, and B, the quality of your wool is a little bit declined because you're taking some of it away prior to the shearing. So if wool is something that's important in your operation, this is a consideration to make. But woolly ewes are, it's good to get that removed out of there for ease of those lambs being able to figure out how to nurse. Another thing to consider with lambing is getting those jugs set up. This is my personal barn, and my jugs are much larger than you would need necessarily for sheep. Usually it's 4x5 or 5x5 areas. These are more like 7x8. But one of the things that I wanted to point out with this is, you've got these kind of more safe heat lamps that you can provide to keep the lambs warm. You can have heated buckets to keep water warm. There's a lot of ways that you can do this. This is a grafting stanchion, which from just a very personal standpoint, I love this grafting stanchion. I've had it for just this year and I've used it twice already in my lambing. So, but one of the things here is making sure you have good ventilation in your barns, provide straw that is clean in between uses. Here's some other, this is the US Sheep Experiment Station. The jugs, they've got several barns that look like this. They work thousands of sheep through when they're lambing. So these are smaller. You can see they've got a water trough system that's goes through the whole barn. And certainly for those bigger operations, or if you're set up in a way that you can do that, that's really handy. You can also buy panels or various other ways to do those jugs, but making sure you trade out the straw or the shavings, make sure they're clean, because this is going to be important for spread of disease as well as potential for mastitis. In between, clean those out, and you can use lime to kind of help disinfect, get things cleaned up, let that dry out, and then reapply the straw and or the shavings. So again, good ventilation. You don't necessarily need heat in the barn, because sheep do produce a lot of body heat, but you can certainly add a small amount of heat if you feel like it's necessary. I won't go into a lot of detail here, but if you are seeing multiple late-term abortions in your flock, there is a potential that you've got some kind of a disease going through them. A lot of times they are sexually transmitted or just something that you have in your environment. Just note that they're zoonotic, which means that they can be transferred to people. Most of these, and some of them have vaccinations available that you could provide to your sheep if you're having problems with this. But the diagnostics are, vaginal swabs, blood samples, a piece of the placenta, and sending in the aborted fetus. And there are labs that will take all of these things and test them for you to tell you exactly what it is that's causing those problems. If you're seeing it happening more than just one or two, you might want to take some samples and send them in to make sure that you don't have any issues going on. So those are some considerations as we move up to parturition. Now it's happening. Hopefully we're ready and set up and we have all of our equipment ready to go. And I just wanted to touch on a few things during that time period of lambing. So most of the people on this webinar are probably familiar with what labor and parturition looks like in sheep, but just want to touch back on some of these things for the sake of conversation here. So weeks in advance of lambing, you're going to see signs of milk production. So their udders are going to kind of tighten up and start to show signs of milk production. And in the very last day, they're going to be very tight and often kind of swollen and red. In the day or two leading up to parturition, you're going to see the vulva relax and become more swollen. She may be producing some discharge of some kind. And you'll notice that she's going to have the lambs drop down in her body, in her body cavity. And it's going to create kind of that void in front of the hips. So you can really see them drop down and get ready to in position for lambing. Sometimes they're going to change their eating behavior and they're going to start to nest or mother. Sometimes they'll try to take another ewe lamb, get defensive, sort of become acting odd, not eating, whatever it may be. Sometimes you never see any of these signs until she's having a lamb. On the day of, within a few hours of parturition, she's going to become in discomfort If she has a tail, she may kink it like in this picture here. She'll be pawing at the ground. You're gonna see increased respiration rate. A lot of times they're gonna become more vocal, and you're gonna see that water bag appear. So this is that nesting period. There's a short video of her she found her spot. She's gonna turn around in circles and act silly and tell that other ewe to go away because this is the spot I'm having a baby in. Once she has a water bag, I like to see those lambs coming within half an hour. They don't have to be born yet, but you want to see them making progress. It can take up to an hour for that to sort of all occur. If it's the first time ewe, she doesn't know what she's doing, it might take a little bit longer. But usually for me personally, if the water bag has come and there is no progress of lambing within the first hour, I will go assist. This is when she's completed her nesting and she's going to start pushing that lamb out. If she's going to have more than one baby, it's going to take 20 to 30 minutes after the first one is born for the second one to come. And during that time, she should be wanting to get that lamb up, bring him in, clean him up, get him nursing, and then that second lamb should arrive. If they're not up and nursing within about 30 minutes, especially if it's cold, you want to intervene a little bit there as well. If it's not that cold outside, I'll give them up to an hour. You want to just kind of monitor if they're up, moving, working at it, trying to find milk. They're still warm enough to do so. If they're laying on the ground shivering, it might be time to warm them up a little bit and help them out. I won't get into the details here because there's a lot to go through, but these are all the ways that a lamb can present that may cause some problems. This is what we like to see: front feet out, head coming behind it, and the lamb is going to be born properly. These are all ways that could cause some issues, especially if it's a young ewe or some other possibilities there. You've got a leg back, you've got both legs back, maybe we're a little bit tangled. We've got a head back. In fact, this morning I pulled one of mine that had a head like this. This is a very challenging position to get a lamb out of when they're lambing, but certainly can cause some issues with lambing. And if they're backwards or upside down, some of that type of thing. Another thing is if there's more than one in there, they can get kind of tangled up, both trying to come out at the same time, that type of thing. So if you're assisting a ewe with her parturition because she hasn't been able to make progress and get it done herself, these are things to feel for. Typically, I will go in, I will find the front feet or the back feet, and you can work your way up and find the head or the tail or whatever. You want to make sure that both feet are attached to the same animal when you start to pull, because you don't want to be pulling the foot of each of two lambs. They can't come at the same time. You certainly don't have to wait necessarily to see if they need help to identify whether or not the lamb is going to be presenting correctly. So if you see feet coming out the back end and the toes are pointed up, that's usually a good sign. And then you'll want to see a nose coming behind them. A lot of times if you see just one foot hanging out or just a nose hanging out, or maybe the feet are upside down as they're coming out, it may not hurt to get her in and help her make sure that everything comes quickly and that the lambs are okay. So just a few notes on assisting. You want to catch her, whether you have a head catch or a halter or whatever it may be. Make sure that you wash your hands, wear gloves. These are important both for her own safety and biosecurity, but also your own, because like I said earlier, some of the problems that can happen in sheep can also be spread to people. And especially if you are a pregnant woman who's assisting a ewe, you want to be really careful about fluids and that type of thing. You want to apply lube so it's easier for her, and you want to just be very careful in finding what's going on. And when you're pulling, you want to apply downward pressure. So if she's standing up, you're going to pull towards the ground because that's the natural way that the lamb would be coming. And then once those lambs are born, you put them kind of up on their chest so that they can get good breaths and clean, wipe away all the slime from their nose and mouth so they can get good deep breaths. And if you do assist her, make sure to check that there are no more lambs in there. You want to pull them all at the same time. And then you want to give her a chance to mother them, let them bond, let her lick them off, let her get them up and going before you assist with any sort of nursing. Again, allow those lambs to search and find if they can. If you already have her caught, just strip her teat, which means milk it out just once to make sure that that wax plug comes off. That gives them a better chance of finding milk. And if you're having to assist, you want to carefully insert the teeth into their mouth, and hopefully they're able to start figuring it out on their own. If they're not giving it an honest try, if they're not suckling, they're not even looking, they're probably cold. And so that's one thing to have that handy thermometer and check their rectal temperature. If they are less than 99 degrees, you need to get them warmed up before you worry about anything else. And the inside of their mouth should be warm. If it is not, then they're definitely cold. So certainly the first thing to check if you're having any issues with getting up and suckling is temperature, because if they're cold, they're not going to do what they need to do. Ways to heat them up are, you can towel them off, get them in front of a heater. Some people have a warm box. If they're really, really cold, like 97 degrees or less, a lot of times I like to put them in a water bath. This is the fastest way to get their body temperature up. You want to make sure you're there the whole time to hold their head up out of the water. Sometimes it takes 5 minutes, sometimes it takes 20. It just kind of depends on how cold that animal was. Don't start with hot water though. Start with lukewarm or even cool water and heat up the temperature as that animal starts to warm up. And certainly they'll start to shiver if they haven't been. Shivering is a good sign, but you want to get them warmed up past shivering. I like to use just a heat pad if they're not ultra cold, if we're talking 97, 99, 100 degrees, just to get their body temperature up a little bit. I'll put a towel down over the top of a heat pad, and then I put them in front of a little cadet heater in the bathroom. So there's a lot of ways to do it. You want to make sure you're not burning or scalding them in any way, but you want to get them warmed up as quickly as possible. And there's no need to feed them if they're cold. If they are below about 101 degrees, get them warmed up before you try to feed them, because their body will not use that feed until they're warm enough to utilize it. So we already talked about why colostrum is so important. Make sure that these animals are getting colostrum, that's the first milk, in the first 12 to 24 hours. If you are having to assist or there's an issue with the dam, best case scenario, milk her out and use her colostrum, because all of the antibodies that she has to the environment that you are in are going to be in that colostrum. There are alternatives, colostrum replacers, and I'll talk about those in a second. You want to feed it at about body temperature, so about 100 degrees, 101 degrees. Don't get it too hot. And if they're really newborn, you want it to be at that point. You don't want it to be much colder than that either, because that can chill them. So you want to kind of target that 99 to 101 degrees. They are going to need 20 cc's per pound of their body weight over the first 12 hours. So usually what I do is give them, 2 or 3 cc's in the first feeding. And sheep, if they have a choice, will eat about every hour in the first couple of days. So I like to feed them every 2 hours. And I know this is a daunting task if you have to do it all night and all day and all night. But this is the best case scenario for this animal. The more often they eat, the better they're going to do later in their life. So every 2 hours, and you want to be really careful not to overfeed them at each feeding, but they need to get enough as well. I also like to provide a probiotic. There's a lot of options out there. Just a little tube that you can squeeze a little bit into their mouth. There's a great energy drench called NutriDrench, and there's a couple of other options out there as well that's very similar. This is just a really high sugar, glucose, just squirt a couple squirts in their mouth, and it really gets them going. This is a great thing to have around. It does not replace colostrum or milk, but it does give them a little bit of a boost. So if, say, you had a tough pull and it's kind of cold, give them a little squirt of NutriDrench and they're going to be up and looking for milk in no time. Vitamin B is good for both the lamb and the mother. If you've had a tough pull or something of that nature, if they're having some issues, vitamin B is the healing vitamin. And in the first 12 hours, but even over the course of the first couple of months, really watch for issues with diarrhea. And if they're having issues getting enough to eat, they're going to be hunched over. They're going to look like they're just not doing very well. Sometimes they're shivering a lot, that type of thing. And if you're seeing something that makes you feel like they might not be getting enough to eat, you can get a weight on them every day. If they don't improve if their weight doesn't bump up a little bit every day, then they're probably not getting enough to eat. So whether this is, a ewe that's taking good care of her baby and maybe just doesn't have enough milk, or she has too many babies, I personally don't let my ewes raise more than 2. So I'll pull the third one off and self-raise it. But sometimes there's just not enough milk. And so it's important to watch for that because they could starve to death pretty easily. And a lot of times it's easy to miss the signs if you're not looking closely. So the colostrum replacer, there's also colostrum supplement. And I just wanted to point out that there is a difference between these, and there's also a difference across colostrum replacers. So supplement, for example, is not a replacer. You cannot use this as colostrum for your babies. And like I said, best case scenario, use colostrum from one of the mothers in your flock. But if you don't have that, or if she's having a hard time milking, or if you want to replace the NutriDrench with something like this is just going to help them have enough energy to do what they need to do. But it's not going to replace the immune response that they get, and it's not going to replace all of the energy and protein that they need in that first few days. So just keep that in mind when it says supplement, to make sure you use it as such. There is going to be some other kind of colostrum that's there with it. Colostrum replacer, this is where if you have a mother who dies or won't take her baby, or maybe the baby is so weak and cold and early or whatever that you're having to feed it, and maybe she doesn't have milk or whatever the circumstances may be, I always have one of these colostrum replacers on hand. They are also not all created equal, and I'm not here to promote one brand over the other because it doesn't really matter to me on that front. But one of the things to keep in mind is this IgG content in this. So this particular colostrum replacer has 150 grams of IgG, which that is the antibody that they're going to get from the milk. So 150 grams in a 500 gram feeding. So they then have a whole other situation on the other bag, which is 8 grams of IgG, which is also globulin protein, per 2 ounces. So when you do the math that says ounces to grams, what this is saying is this is 150 grams of IgG compared to 21 grams of IgG in the same size feeding. So that's what you want to look for. The more, the better, but you want to have more than 40 or 50 IgG in that colostrum replacement. And the other thing to consider when you're talking about colostrum is that you have to keep in mind it needs to be a sheep or goat specific product. And here's why. So sheep, in a natural milk of a sheep, you have anywhere from 5.9 to 11.6% fat. And if you look down here, goats are 3 to 5% fat and cows are 2.5 to 4% fat. So you can see that sheep have almost double the fat requirements that goats and cows do. There's also a greater requirement or a greater content of calcium in sheep milk. And so there's a lot of reasons why, if you have a sheep specific replacement, whether it's a colostrum replacer or a milk replacer, that you feed them the right species, because that way they're getting what they need. A lot of people do use cow milk in lambs, and they ultimately end up with a lot of scouring and that type of thing. Does it work? Sure. Does it work the best for the animal? It does not. So you want to make sure that your replacements are specific for sheep if you're going to be feeding them to sheep. A quick discussion about tubing. This down here is a little lamb tube that you put on a 60cc syringe with fat nose. This is inserted then into the esophagus. So this is the proper position. You want to set them up on their chest and hold their head at, an angle, not stretched way out. And then as you insert that tube down, you're going to be able to feel it go down all the way along along the side of their trachea there. So you'll be able to know that it's into the stomach. This is something that makes some people feel really uncomfortable, and I would recommend visiting with somebody who has done a lot of it and knows how to do it, to kind of help you get more confident. If you do insert it into the trachea, into the lungs, it will kill the lamb if you give them the milk. But with some practice, this is a really easy thing to be able to do. And like I said, one of the things that I do, I feel it go down all the way in there next to the trachea, but I also give it I blow into the end of it just a little bit. And if it doesn't make the lamb cough and hack, then you're probably in the right place. And you cannot insert it too far. You want to just make sure it gets down below, far enough that it's into the stomach. And then you want to slowly squeeze that milk in, and then make sure as you are pulling the tube back out that there's no milk draining as you're pulling it out that they could choke on. And the last thing, if you are going to feed some kind of creep to your lambs as they get older, lambs will start eating hard foods by 2 to 3 weeks old. So you can provide them a creep supplement that will help them grow faster and that type of thing, take some of the pressure off of your ewes lactating. But you want to make sure you give them between 15 and 20% protein and 2.5 to 5% fat. And that gives you a good starting place when you're looking for a lamb creep feed. I like to start them where they have access to it from really early, so that when they start to sample it, they're not going to eat more than they should and get sick. And you can put these little creep fences up so you can provide the grain to the lambs, but the ewes don't have access to it. And this is especially important if you're going to have an early weaning scenario, or if, say, you've got some orphan lambs, that type of thing. These are really good opportunities. I think I'm kind of running a little short on time. I wanted to talk really briefly about biosecurity, just because lambing is the most critical time for disease spread. So I'm going to jump through this a little bit quickly, but I'll try to touch the high points. You want to have all of your equipment on hand, and it needs to be disinfected and sterilized as much as possible. If you have things like syringes and needles, make sure they're new and sterile. New gloves when you put latex gloves on, that type of thing. And as you're walking through pens, if you have a sick pen, the biggest key here is to start with the clean instrumentation and equipment in the lambs, because they're the most susceptible, the healthy lambs. Then you can work to your healthy ewes, and then you can work through to the sick pen. You do not want to track the sick pen through all of your healthy animals. So that's something to keep in mind. A reminder to keep good records, because especially if you're treating animals, you have withdrawal periods, you want to look back and see what they were treated for. Sometimes these are great for culling decisions. If you're having to treat animals, it may be warranted to get rid of their mother or them or any of those things. If you're having reproductive issues or that type of thing. Again, going through sterilizing as much as you can when you have pens and trailers and all of those types of things, just make sure that they're clean and mucked out, and any possibility for disease transfer, just do your best to sort of hold that off. And going back to my nutrition background, disease can be controlled primarily through nutrition. There's a lot of things that can happen in your flock that are not nutrition related, but if you have a great nutrition program and your animals are very healthy, a lot of these things can be avoided. So you want to work with somebody, and like I said, I'm happy to help if that's something that I can do for you, to make sure that you're feeding the proper ration to your animals. But healthy animals have a stronger immune system, and they're going to be more able to fight diseases and parasites and that type of thing. And certainly if they're in poor condition, especially if it's just one or two animals in your flock and the rest of them look good, these animals that look like this are going to be more susceptible to disease, and you're going to have issues as things go along. So just another plug to do good nutrition in your flock. Minimize stress wherever you can, handle them quietly, put them in facilities that are appropriate for what you're trying to do, that type of thing. Give them good, clean air in the barn, good, clean water, good feed. Make sure they're housed in a way that they're not stressed out from social issues or not enough space to get feed or that type of thing. And finally, I like to always mention that boots are a great way to spread disease. If you are visiting somebody else's farm or they're visiting yours, sheep and goats are so disease spreading, and it spreads to people too. So the best way that you can do is to keep each, if you have a pair of boots for your home farm, keep them on the home farm. And don't let somebody else come in with dirty boots from their farm that's going to cause some issues for your animals. And one of the things I got told once a long time ago that has always stuck with me is, even if I don't wear my boots from the farm to somebody else's farm, I often will wear my boots from my farm to the feed store. And guess who else also wears their boots to the feed store? Everybody who goes to the feed store, right? So it's just something to keep in mind for the biosecurity, keeping your animals healthy. And I think at this point I can take some questions. This is the ways that you can follow what we do. We do, like I said, the monthly webinar. All of the webinars that we've done in the past 5 years are on this YouTube channel, so you can click into that. It's the University of Idaho Extension Livestock channel. We have everything we've talked about today and more in a lot more depth if you want to check it out and watch some of those webinars. And then we also have a Facebook page that keeps people up to date. So please feel free to reach out to me. This is my email address, and I'll take any questions that you guys might have.
Thank you so much, Melinda. So if you guys have any questions, you're more than welcome to unmute your mic, or you can insert your questions in the chat box. Okay, well, some of you may be gearing up some questions. I am going to release the polls. So if you wouldn't mind, there is going to be a poll that pops up in front of your screen, either on your computer or your phone, and it's just going to ask you a couple of questions for this evening's webinar. So if I could get you guys to complete that poll, I greatly appreciate it. It should only take less than 3 minutes. Is there
question?
Okay.
Can you hear me?
Yes.
Okay, this is Virginia.
Hi, Virginia.
Good evening. I have just to make sure that I understand correctly, you did recommend that that the ewes are vaccinated prior to at least 45 days prior to parturition. And then so you can do that with your ewes, and then after the lambs are born, you can vaccinate the lambs separate also, right?
Yep. So we recommend 30 to 45 days before lambing to vaccinate your ewes, and then wait for 2 to 4 weeks to vaccinate the lambs for the best efficacy of that vaccine. So
And-
the ewes will provide the antibodies for the first couple weeks if you vaccinate them in that time frame, and then the lambs can be vaccinated and have their own immune function at that point.
Okay. When we talk about the vaccination, we're talking about the 8-way, the black late vaccine, right?
Yep, an 8-way or a CD&T, any Clostridial vaccine. But the same is probably going to work for any of the vaccines, so long as they're labeled to do that.
Okay. Okay, the other question I have is most of the time when you do the feeding, they're all bunched up in a way. We have feeders, and so you give a percentage, the intake of protein or whatever the content of the feed is. It would be hard to measure who eats what. Some may take more than 5.
You're absolutely right. So usually what I do is if you have some idea of how much your animals weigh, and it
Mhm.
can vary, for example, in my flock, I have anything from 180 pounds probably to 220. So what I'll do is I'll take kind of the middle, the average, and then I will feed whatever that ewe needs, and then just to the number of sheep that I have. So if your average ewe is 160 pounds, like in that example, and you've got 10 of them, then
Mhm.
you can say, what was it, 4.4 pounds a day times 10, and that's how
Okay.
much you can feed them. And
Okay.
I often feed a little bit more just because I know there's some in there that are going to be outcompeted and that type of thing. The biggest thing is making sure that they get enough. And there's always that whole wastage issue
Yeah.
as well, but that's a
Yeah.
good way to just get an idea of how much to feed them.
Right. Okay. There's always a greedy one. So
Yeah. And also know that changes, as they get further along in their pregnancy, they're going to want to eat more. And so you want to adjust what you're feeding to what they're going to need and what they're going to want.
I have a different question. Probably not, I don't know, pertaining to lambing, but we have alfalfa hay, grass mix, and then whole corn, and we usually throw in sweet mix with it to give it the molasses or whatever. But I notice at least 2 sheep would act like they're choking on it, and the food comes back out, while they're eating. Is it just are they eating too fast or
Yeah, I think that's probably what's going on. Mine do the same thing.
really?
And I've actually never had any issues beyond just coughing and choking. I've never had one die from it or anything like that.
No, it's just unusual. So I'm like, would they have some kind of respiratory problems,
Yeah, I don't think that's probably the case unless all of them are doing it every day. But a lot of times, like you said, some of them are greedy and they're going to eat more than they should all at once. And that's probably what's causing that, especially with the grain.
Okay.
Yeah.
Okay. My last question is this I really enjoyed, we raise sheep, horses, cows, but my main focus is on sheep, and the PowerPoint you just gave. Where can I get a copy of it?
Cool. I'll defer to Michelle on that one.
Yes. So Virginia, we do retrieve copies from our presenters after we have uploaded their information to their website. So it's going to be on our website.
On your website?
Yes, and I'll share that after we conclude with tonight's presentation.
Okay, that sounds good. And thank you very much. I appreciate it and I enjoyed it.
Well, thank you for having me. This has been great.
Thank you, Virginia, for that question. Were really good questions, though. You do have another question in the chat box. I have a goat who is due to kid the end of next week, but has little to no bag. I'm assuming it's a milk supply yet. I'm getting concerned, but she is also a first timer. Could she still, her milk supply come up closer to the due date?
Yes, absolutely. Especially being the first timer. She's probably making some milk. It's just not showing yet because she's never had one before. I'd be curious if the due date was because you saw her get bred or know that she was for sure bred on that date, or if that's just when she was exposed to the male. Because a lot
Yeah.
of times you're going to see potentially a 2 to 3 week window after the due date that your does can go. So I wouldn't be too concerned yet, but I would keep an eye on her. But certainly the milk in some of the ewes and does doesn't come in till the last couple days before lambing. So it's very individual. And sometimes it really doesn't come on till the day that she has the lamb or the kid. So yeah.
I hope that answered your question, Ms. Shepherd. Are there any more questions from our audience tonight? Okay. Well, I had a question myself. As far as the NeuroDrench, do you, give it to the lambs that are having trouble, latching on for the first time? Or is that something that you give for lambs that are basically, who we're going to be raising?
Either way, it actually isn't bad practice to give almost every lamb a dose of that. So it's usually 2 squirts out of the little squirt jug that you can buy. But it's just a little boost of energy, if you will. So if there's a lamb that's having trouble nursing, it's just going to give them more energy to keep trying. So that's a lot of times what I use it for, is to just give them that extra energy. But I oftentimes, if I have anything happen that's not just a normal birth that happens and she gets them up and they nurse and everything's fine, if I have to pull them or if I bring them into the barn and they're not quite up and going yet, it doesn't mean that they wouldn't be able to without it, but I'll still use it because it's relatively cheap. You can use it just to get that extra energy boost, and it's going to keep them wanting to look to find the milk. So that's what I like to use it for, especially if it's cold outside. So
right. Okay. And another question, and this is what Virginia was touching base on, is as far as, vaccines, for the lambs, that chart that you pulled up, is that kind of like a side by side, either that, if we miss vaccinating our lambs at 0 days, we also have like 21 days or some amount of days, when they hit the 21-day mark, we can either vaccinate from either 0 days or that 21-day mark, right?
So the chart that I showed was indicating that in the first week or 2 of their life, they're actually just not getting as much of a benefit if you vaccinate them than if you just wait till they're 2 to 4 weeks old. Vaccinating at any given time is not a bad thing because you're providing that immune response. So if you're the kind of producer that you want to vaccinate on day 0 because that's just when it's convenient, it's still going to give them the benefit. If you have an option to wait till 2 or 3 or 4 weeks, and you've also given the ewe her vaccine, then you're going to get just more of a benefit from it. But it's not necessarily you didn't catch it at day 0, so you have, it can be any time. It's just a matter of when it's the most effective.
Okay. Is there a reason why it's not effective when they were in that first week?
It's so with the sheep, they don't have a developed immune system when they're born.
Right.
So as they get a little bit older, their system starts to develop and they're able to utilize that a little bit more. So if they're using the immune response that they get from their mother in the colostrum, the first couple of weeks, that's where they're getting the best bang for their buck. And then once they get through that period, giving them that vaccine just boosts them an extra little bit. So it's just because they're so young and their immune system is naive and it's just not working properly. That's the
Right.
problem.
Okay, that makes sense. Thank you. We'll take one more question. So, Eloise, if you unmute yourself, please.
Good evening.
Good evening.
Hi there.
Yeah, I'm driving, but I have a question. What do you do with a ewe that gives stillborn birth?
Well, it depends on a couple of things. If she has just a natural stillborn birth that she's fine and there's no discharge, and you know when something is stillborn and you kind of get the gross brown something's wrong kind of mucus coming out, I might give
Yeah.
her a antibiotic of some kind just to help her clear that out of her system. Sometimes you can give them some oxytocin to encourage movement of all of that stuff to come out as well. But as long as it's just a birth that occurs and there's no issue there, I don't worry too much about it. You just want to make sure you dispose of that stillborn fetus where it's not
Okay.
exposing to other ewes or other lambs.
One more question. What causes them to have stillborn? Because I have one, they're ready, the lambing starts in about 3 weeks now, but
Mhm.
a week and a half ago, one had a stillborn, and it looks like it was ready to be born. You know, it was like, you know, mature enough to be born, but
Sure.
um,
So
it's
I
still
think
a still.
there's a number of things that can happen. Some of them could be
Okay.
disease related, but I wouldn't worry about that unless you start seeing more than one have that problem.
What related?
What's that?
What did you say it was related to?
Oh, it could be a disease issue, but I wouldn't worry about it
Okay.
until you
Okay.
have more than one have a stillborn baby.
Okay.
So if it's just this one that had that problem, it could be a number of things. The fetus maybe didn't develop the way that it should, and there was some issue internally. That could be a problem. She could have fallen down and hit her belly on something or gotten a scuffle with another animal and had an issue that way.
That's exactly what I was thinking.
Yeah, there's a lot of reasons that that can happen, and sometimes it's just not meant to be, I guess. So as
Okay.
long as you don't have a lot of animals having the same problem, I wouldn't worry a lot about it. Or if she keeps having the same problem year after year, then you're going to have a concern there as well. And it may be that she
Yeah.
doesn't have the right parts or hormones or whatever she needs to be able to do it. But a one-time situation, it's unfortunate, but I wouldn't worry about it too much.
Okay. Thank you for answering my question, and I
Oh,
really
you're
enjoyed
welcome.
the class. It was awesome. So
Thank
hopefully you
you.
guys have more.
That'd be great.
Thank you. Have a great evening.
Thank you, Eloise, and thank you everyone for tuning in for tonight's presentation. I really appreciate it. Thank you for all the questions that you had. Definitely, this is something that we do need to conduct sometimes in person, a lot more, engaged with our audience. So definitely thank you all for sticking with us all towards the end. So I just want to thank our presenter here for having some time out of her busy schedule to provide us this great presentation. So thank you a lot. you are more than welcome to stick around if you want to. I'm just going to share a bunch of updates and just doing our closing remarks.
All right. Thank you for having me.
Yeah, and if you could forward me a PDF of your presentation, then I can go ahead and share it to our platform.
Sure, no problem.
All right.
you.
Well, thank you
Have a
so
good night.
much. All right, you too. So for everyone on here, I know we kind of went over our time frame, but that's okay. The more information, the better is what I always encourage our producers to, stick around because all this information is pretty useful. And it just shows, here tonight that with your questions that you had, you definitely wanted them to be answered. So thank you so much for hopping on here today. And I hope to see all of you guys as polls, questions about, what other upcoming workshops that you like to hear more from us. Definitely, we love to have some of these folks come out in person and provide this type of information. I think it'll be very helpful. But I'll look forward to your comments section later on tonight. So that's what keeps me rolling to provide these type of resources for you guys. So with that being said, we're going to go ahead and move forward to our upcoming events. This has been on our screen for like a minute or so. So we have a livestock record keeping workshop, and this is going to go throughout the whole month of February. We do have our kickoff for the first week of February on the 6th, and this one's going to be hosted at Tuba City Chapter House. Normally we don't step out of our area of program zone, but definitely we have been seeing a lot of requests that's coming from the Western agency side that they want to see more workshops be held there. So definitely this one's going to be one of them. So we do have a lot of production records that we want to provide you guys in case you do want to come out to these things, such as treatment records, culling records, vaccine records, and so forth. So a lot of those production records that we're going to be handing out and showing you more into detail on how to fill them out. And we also have a financial record keeping calendar that is basically fit for any type of year. We will show you kind of an overview on how to navigate through that calendar. And later down, maybe towards these months, we would actually host a financial record keeping workshop that's just going to be, just based on finances. So this one's going to be more leaning towards the production type of record workshop for both cattle and sheep. So if you are around on February 6th in Tuba City, definitely, show up. It's going to be around about 1 p.m. So you'll be receiving all types of resources for that day. So like I said, February is going to be nothing but record keeping workshop. We do have another one that's going to be hosted on February 10th at Crown Point Chapter House. So this is going to be from 10 a.m. through 12 p.m. So with that being said, we do have not only provide resources for like workshops or agriculture related workshops, but we also have a conservation planning program. So we do have one of our specialists on here that controls and navigates our conservation planning program, Miss Shirley Toth. She and several other of our technicians are basically trained to provide some assistance to you to help develop a basic conservation plan. This is free of charge, and if you are located in the Eastern or Northern Navajo Agency, you know that part of attending or obtaining your grazing permit every year you are, kind of required to update your conservation plan. So definitely, if that's something that you're interested in, please email Miss Shirley Toth. Her email is just right here, toth@nmsu.edu, and she can go ahead and get you scheduled. My mouse is not working, but Thank you everyone for attending for this evening. We are on Facebook. That's where our main attraction is for our upcoming events. So if you want to look us up on Facebook, we're called the Navajo Sustainable Agriculture Project, and we notify our followers for in-person workshops at least 4 weeks ahead of time, and our webinars 2 weeks ahead of time. You'll be seeing the YouTube, this webinar on our YouTube channel next week, along with our presenter's information about her presentation slides and any type of resource that she would want to plug in as well that's related to our topic from tonight. And we are kind of slightly behind on our bi-monthly newsletter for December, but we will get that rolling out as quickly as we can for before end of this month. But I just want to say thank you, everyone, and I hope that you learned a lot from this evening's presentation, and I hope you guys have a good rest of your night. Thank you so much. So, in short, we're called the NSA Project, and we are funded by the USDA Outreach and Assistance for Native Farmers and Ranchers and Veteran Farmers and Ranchers program. We are normally partnered with several of our project partners, which you see their logos on here as well. One of them is the Dene College Land Grant Office. They're stationed out from Saline, but they also have several colleges here on the reservation, as well as Community Outreach and Patient Empowerment, which other stands for as COPE. So these are the two main project partners that we collaborate a lot with when it comes to webinars, when it comes to workshops that can be agriculture. Well, there are agriculture related, but more specifically with Dene College Land Grant, we do provide livestock related topics, and for COPE, we do provide horticulture topics as well. So overall, the NSA project is to help our producers, improve their operations, both profitability and sustainability, in areas where we deliver in-person workshops and webinars that are tailored to our producers' needs based on the feedback that we gather from all of our evaluations in person and from our webinars as well, that you will be receiving a poll at the end of our presentation tonight to see how well you have been familiarized with this presentation before and after. So, and how you're going to take this information back and how you're going to implement it into your operation. So the past couple weeks, we have been conducting a lot of record keeping, as well as for livestock and typically for cattle and sheep, as well as goats. And we have been conducting a lot of cattle reproduction as well, in-person workshops. So we really like having to prep for these type of workshops. We get to meet a lot of different folks, a lot of different people from different type of agencies. So it's really great to see everyone that wants to improve their operations as well. So, and another bullet point that you see here is increase our Native producers' knowledge in the use of USDA programs. All of you are quite aware with these 4 programs. One of them, of course, is NRCS and FSA, Rural Development and Risk Management Agencies. So we do host what you call a USDA resource fair. Sometimes we squeeze in some of our local Department of Agriculture from the Navajo Nation to wanting to share their side of the platform on the Agriculture Infrastructure Fund. So we do have local field offices that provide assistance and programming resources that are pretty much tailored to local producers. So, and lastly, increase our local production and consumption of our fresh fruits and veggies and healthy foods by Navajo families and individuals. So this is our horticulture program that we offer as well. So we are connected with some schools here on the reservation and conducting hoop houses with the help of our project partner, which is the Dene College Land Grant Office, and as well as small families here locally in Crown Point. So with that being said, I'll go ahead and transfer the floor over to Dr. Ellison, and she'll go ahead and give her introductions. Okay, you should have the ability. Yep, there you go.
Okay, perfect. Well, I want to start by thanking Mikkel for bringing me on today. This is a different group for me to talk to, which I always love to. I wish we were in person, we can meet and get to know each other better, but we were just talking before the webinar, maybe there will be an opportunity for that at some point. So today she asked me to speak on preparation for lambing.